Let's do a quick lesson about the types of Medicare. I know it sounds boring, but I promise it's important. So, to make sure we're clear, Medicare is the national federal health insurance program. Started in the 1960s, signed into law by Lyndon B. Johnson, yada, yada, yada. It is our national federal health care program. It is the only national federal program. It's available to adults 65 and older, those with disabilities, or those with end-stage renal diseases. So first things first, we have Medicare Part A, which is like your traditional Medicare. So everyone who has Medicare at least has Medicare Part A. It's your hospital Medicare coverage, so covers like hospitals, acute care, inpatient hospital stays, inpatient rehab, skilled nursing facilities, home health, most of post-acute care. It does have like a deductible and a benefit period for patients, but it doesn't have a monthly premium. Now, Medicare Part B is like your primary care coverage. So it covers like doctor's visits, labs, testing, those sorts of things. Also covers like your outpatient therapy and then your observation hospital stays. So people who aren't actually like admitted to the hospital, they're under observation stays. So they're not actually admitted in. And so that covers so that's Medicare Part B, and this is an optional Medicare coverage. So you have to opt into Medicare Part B, and that usually has a premium. So that's why when everyone talks about the premiums going up, they're talking about for Medicare Part B. It does not cover drugs. That's under Medicare Part D. D equals drugs is Medicare Part D. So Part B has a co-insurance for services. It also covers durable medical equipment. And so co-insurance is a percentage of the services that the patient owes. So every time a service is provided under Medicare Part B, the patient has a 20% co-insurance. So when you see them for therapy, Medicare pays 80% and the patient pays a 20% co-insurance on that service. Last but not least, we'll talk about Medicare Advantage. Now, I know technically Medicare Advantage is not Medicare, but it's good to know the difference. Medicare Advantage is a kind of like a Medicare replacement plan. And so it is run by private health companies. So like Aetna, Blue Cross Blue Shield, Cigna, Humana, they have Medicare Advantage programs. Now, by law, they're required to cover the same things that Medicare does. However, the way that they save money is by doing like a pre-approval process. So like a lot of services have to be pre-approved versus under Medicare, it doesn't have to be pre-approved. You're just like, as long as you have the benefit coverage, it's covered. But under Medicare Advantage, you usually have to go through this process to get things approved, and because it's run by a private company. And sometimes they have additional benefits, like they might cover hearing and dental or those sorts of things, and that's kind of the incentive for Medicare Advantage, but it is different from traditional Medicare. If you learned something new, give it a like, share it with a friend, and make sure to follow me for more information on occupational therapy policy, Medicare, and all the stuff that you need to know to make sure you're following the law.